Dr. Mahmoud from Egypt.
Thank you. I mean, this presentation was supposed to be done by one of my assistants, but unfortunately I couldn't get funding to come for a long flight here. Okay. Here is a patient-specific instrument. As you can see here, there are 5 main steps. The CT scan, the planning on the software, and then during the planning also we create the virtual PSI files. And then number 3, it goes to 3D printers for printing physical templates. And then number 4 is the sterilization packing, and then surgery. Actually, the main difference between the hospital-based PSI and the industrial PSI is that these 5 steps are done in the hospital, while the industrial PSI, most of the implant companies, they outsource. So at one stage when the PSI started, companies used to outsource probably like 4 of these steps. So the scanning is done in certain imaging center, not necessarily to be in the hospital. And then the planning was done in Belgium, and 3D printing was done in Germany. And then it's sent back, for example, to a US implant company for packing and sterilization. So they mainly used to do the packing and the sterilization and then send it to the surgeon. While with a hospital-based model, all these 5 steps are done in one site, in one location, and this is the main difference. This is a patent for me on hospital-based model and technique, and this is also a publication explaining the concept, and also is a study on the proof of concept was in more than 250 cases. This is also our European certification. It's not an FDA yet. And this is an important slide because people might ask, what is the regulatory and legal issues with regards to hospital-based PSI? So I just made a comparison here between industrial and hospital-based. With industrial, definitely the majority of them, they have got FDA and CE approved. We have CE cleared, but not FDA yet. The problem with industrial PSI that is run by technicians, and that's why they have to do only straightforward cases, while with others is run by surgeons, and there is no outsourcing. There's also cut on, the cuts are based on its implants. So for example, if an implant company will say, okay, these cuts are based on our implants, so how you do the cuts for something that you did not manufacture. Actually, we do the cuts based on standard parameters for TKA. And also the question about PSI being used for certain particular implants. The answer is that this is a technique. Some surgeons use different ways of guiding. Some they use C-arm inside the operating room, and others don't use company instruments. They use like freehand cutting for patella. Some senior surgeons I worked with in UK, they use freehand cutting for tibia. So it is a surgeon's responsibility to perform his surgery and do the technique that he likes. Needless to say that the same production machine and also materials are the same for the 2 techniques. But the difference here, the different patterns, different software, and different logistics. So the advantage of the hospital-based, there are 5 things. First is that because it is done by the surgeon, so he can do complex cases. And also there's a CT-based with cheaper, wider application and easier segmentation, and also time saving. It's a shorter delivery time and less expensive, and it eliminates completely the use of conventional instruments. As you can see here, advantages of industrial PSI. It's on the market definitely worldwide. It's the largest user, publications a lot. So we did a comparative study where we looked at conventional instruments, industrial PSI, and hospital-based. And we looked at 3 different implants. And you can see here the differences between the 3. With industrial PSI, the number of steps was about 29 steps as compared to 70 operative steps for conventional. So definitely it is much better than conventional, but still the number of steps reduced into 21 with a patient-specific hospital-based model. Also, the number of instruments, as you can see here, the differences. So definitely, hospital PSI was better. Here is 8 different applications that we use with the hospital PSI. It's not only for total, it's for unicompartmental, also osteotomy, total shoulder, total hip, tumors, spine, and also spacer. So my message is that hospital-based PSI is an application looking for a technology as compared to other high-tech robotics and navigation, and also that's a PSI, which is a technology, was just looking for application. Thank you.
Thanks, Dr. Mahmoud. Any questions?
Oh, good. I have a question.
Yeah.
Tell me, how much work you actually put in from the surgeon's point of view? Because obviously when it goes away to the company, it all comes back. How much more work is there if it's a hospital-based PSI?
Right. For a surgeon, during the planning takes about 15 minutes on the computer. And when you have a complex case, it is really fun because you can see the 3D. You can see things which you cannot see during surgery. And if you trust the technique and the computer, you can just say default technique, and it just do the default technique for you. It choose you the result, and then you can change if you like. For example, you say, all right, I change the sizing of the femur, make it bigger or smaller, and see how it looks like. But if you wanted to do every step, this may take about half an hour or so. Yeah.
Thank you.